I don't know. I mean, you know, obviously we've heard that the vaccine, which I think we'll talk about in a minute, that the state of California, Governor Newsom, has already come out and declared that he's going to put together his own team of experts to validate the efficacy and the safeness of the vaccine. And I'm not aware of any other state in the country that their governor or their state government has said that we're going to put it through another level of scrutiny before we allow our residents to receive the vaccine. So it might stand to reason that we might be the only state that's not accepting the antigen test. So, yeah.
Well, but then at the same time, Gary, as we move into talking about the vaccine, it's a little nerve-wracking to take a vaccine that has been put, you know, out so quickly. Yet at the
Right.
same time, we've talked about all of the major companies that are working together.
Yes.
So,
Yeah, no, I get that. We mandate that our employees get vaccinated for the flu every year. And if you don't get vaccinated for whatever that reason might be, then you have to wear a surgical mask at all times when you're at Cahuilla Delta between October 1st and say April 1st. Now, people this year say, well, no big deal.
Right.
I wear one now. So, so it'll be interesting to see. We're vaccinating our employees right now for the flu, but we will not mandate employees to get a COVID vaccine because we do understand there's going to be a significantly higher level of fear and anxiety about getting it. I do, though, and this is my personal opinion, though, is I think it would be devastating for a company like Pfizer or Moderna to release an unsafe vaccine into the public. The damage that it would do to their reputation and their future existence would be huge. And I think they also understand the consequences, you know, on human life of doing that. And I have full confidence that they are applying the same discipline to creating this vaccine and demonstrating that it is safe and effective as if they'd taken 3 years or the time they've taken. I think they would still go through the same steps. I think they have just deployed so much more manpower and intensity to this that it's still receiving the same, you know, treatment and approach to any vaccine that they normally would develop over the more traditional time frame.
So in light of what you said about the governor, when do you think we will receive a vaccine here at Cahuilla Delta in Tulare County?
We don't know that. So obviously we all got some very inspiring, encouraging news earlier this week that Pfizer, who is one of the leading drug companies, is probably furthest along than anybody, although Moderna is right behind them. But Pfizer came out this week and said that their mRNA vaccine, which is a 2-dose vaccine that you get 21 days apart. So any of you that have got a shingles vaccine, same thing, where you get 2 different doses spread apart. But they, through their testing that they've done using a placebo group and a real virus group, that they saw a 90% effectiveness, that those that have been vaccinated and didn't receive the placebo, they received the real vaccine, and then were exposed to the virus, 90% of them did not become symptomatic or become infected. The downside to this particular vaccine, both I think Moderna and Pfizer, is this mRNA, which is not a live virus. So other companies are developing live virus vaccines that promote an immune response to us. This is not a live vaccine. It is a synthetic vaccine, and as a result, it has to be stored at -80 degrees. So it has to be transported and it has to be stored at that level, both Moderna and Pfizer. So how that affects the availability and the distribution is still to be seen. So I do have some quick information on that too. Thank you again, Randy. So I'll talk quickly about four vaccines. So Pfizer, it's in the phase 3 study. They have 43,538 people that are participating in the study. They're investigating 3 different doses in both 18 to 55-year-olds and 65 to 80-year-olds. Requires 2 doses, 21 days apart. Has to be stored at minus 80 degrees Celsius because it is an mRNA vaccine. Pfizer expects to produce 50 million doses by the end of 2020 and 1.3 billion doses in 2021. So we have 330 million people that live in the United States. If every single one of them was vaccinated, we would need 660 million doses, and they intend to produce 1.3 billion doses in 2021, which sounds like there should be ample supply to go around. The interim analysis results were discussed today in the press release, that the vaccine is more than 90% effective in preventing COVID-19 in participants who did not have evidence of a prior COVID-19 infection. The analysis evaluated 94 confirmed cases of COVID-19 in trial participants. Pfizer plans to submit its emergency use authorization request to the FDA, which is expected to occur in the 3rd week in November. And their clinical trial will continue until the final analysis at 164 confirmed cases in order to collect further data. AstraZeneca is planning to have its data submitted to the FDA by December. They will not require storage at 80 degrees below zero because it is not an mRNA vaccine. Moderna is deep into the phase 3 study. They're just waiting for the trial to run its course so that they can release their results. It does require the 80 degree or minus 80 degree storage. And then Johnson & Johnson, they're finally resuming their trial after being put on hold for 1 month due to a safety investigation. And again, theirs is not an mRNA vaccine, so it does not require that storage. There are 51 companies right now, I think this is worldwide, that are working on developing a vaccine. 51 companies. There are 10 of them that are in phase 3, the final phase, or just moving from phase 2 to phase 3. So I really just shared news on the top 4, that they're part of that top 10, but they appear to have made the greatest progress towards releasing a vaccine. When QuiaDelta will get it, again, we don't know that. However, we do have a committee of physicians, and I think James McNulty, our director of pharmacy, very, very involved in that. But they already are developing the plans of how it would be distributed, how it would be stored at QuiaDelta, how it would be distributed, who it will be initially distributed to, just how we'll logistically manage it. And we definitely want to be one of the vaccination sites for our community. We vaccinate many community members for the flu every year through our clinics and our urgent care centers and our hospital. So we hope that the state and the county will recognize us as one of the major vaccination distribution healthcare entities. So,
What about the freezers? Will we get the freezers?
Yeah, so thanks to the county actually approached us well over a month ago to place an order for us to get, I think it's a minus 100 degree freezer, but using their CARES Act funds that they received, their allocation from the state, they've already placed an order for us for our freezer. But unfortunately, I think it's just one freezer at this point that we would probably store in our laboratory. We'd really like to have additional freezers that we could deploy to our various clinics so that we could keep vaccine on site there.
What is a normal freezer? What's the difference in this freezer and a normal freezer?
I don't think normal freezers go to 100 degrees below 0 Celsius. I know mine at home doesn't, so I'd be afraid to open it, to touch anything inside of it.
Right.
Yeah.
That's interesting.
Yep. So a lot more to come on that,
Yeah.
but as we learn more and more, we'll definitely share it with our community.